critical move of Telesur, a real race against time. This is how the process of searching for, testing, and generalizing a candidate for a COVID-19 vaccine has been defined by practically unanimous consensus of the international community, especially during these months when the health crisis is deepening, both in countries where there are outbreaks due to the early relaxation and in those still considered hotspots of the disease. One stage has been reached in the discovery of this much-needed pharmacological shield, which nations are in the lead. On what ethical principles are they undertaking this race? Let's deploy the board. We're making the first move. Let's review declarations from nations that are at the forefront of clinical trials that are approaching validation and subsequent large-scale production of COVID-19 vaccine candidates. It won't be until next year that we start vaccinating people. That's the first issue. The second is that vaccines are never 100% effective. They generate immunity in most people, only some. In vaccines like measles, which is highly effective, 95% of people are protected. We don't know what stage we're at with this vaccine, so we'll have to wait to see how effective it will be and how long its period of protection will last. There are over 150 vaccine projects. We already have 5 in phase 3 of clinical trials. Our goal is to reach 2 billion doses for access in the first stage of the vaccine, so that countries will be able to vaccinate 20% of their citizens. People over age 65, health professionals, and adults with pre-existing diseases. A plan for the development of a vaccine was approved. 2 vaccines are now the most promising. For the first of these, the state registry provides for an additional clinical trial in August, with 1,600 people. The launch of its industrial production is expected in September. The second vaccine was developed by the state laboratory Vector. Combined clinical trials have already started, completing them in September, and the state registration is also scheduled for September. The first batch of this vaccine is planned to be produced in October. My administration reached a historic agreement with Pfizer to produce and deliver 100 million doses of its vaccine immediately after it was approved. We hope that your approval will be swift. We believe we have a winner there. We have other companies behind us that are getting very good results. We signed a deal with the United States government for 100 million doses. The first clinical trials have been with a single dose. 3 weeks later, the patient will return and receive a second dose. And the data we have so far illustrates a really strong host immune response. For the 100 million to be delivered, these clinical trials must be safe and show effectiveness. We need regulatory approval of the package. This applies to any of our products. We want everyone to get a flu shot before winter. That's why we are running the largest flu vaccination program. In the first place, school children between 7 and 11 or 12 years old, pregnant women, people over 65 years old, but we will extend it to people from 50 to 65 years old. The reason for this is to protect the National Health Service during the winter months, because we are still being affected by the COVID and we have the threat of a second peak. So it's vital to keep up the pressure to stay out of the reach of the COVID. There is always a possibility of setbacks with such a project like this. We can't expect miracles. We still have to assume that vaccines for the general population will not be available until at least the middle of next year. To gain clarity on its characteristics and harmful effects, let's make a brief description of the novel coronavirus that causes the disease known as COVID-19. The World Health Organization defines the concept of coronavirus as a family of viruses that produce various diseases in both humans and animals. Their symptoms can range from a common cold with its respective characteristics to severe acute respiratory syndrome, SARS, highly contagious. In some cases, it can lead to death. According to the Centers for Disease Control and Prevention, coronaviruses are common in the world. Such is the case of the novel coronavirus 2019, SARS-CoV-2, causing COVID-19 disease, identified for the first time in the city of Wuhan in the Chinese province of Hubei last December and spread to the rest of the world. The symptoms of the disease are diarrhea, nausea, fatigue, headache, redness of the hands and feet, problems with the digestive and nervous systems, cough, pneumonia, muscle pain, fever, and difficulty breathing. However, there have been cases on patients who are asymptomatic, that is, who have the virus but do not have any of the symptoms described above and can still infect others. The World Health Organization has warned of the ease of spread in the absence of a vaccine to fight COVID-19. For this reason, several nations have taken severe measures such as suspending flights, work and academic activities, imposing quarantines and reinforcing security at ports and airports where medical checks are applied to passengers who arrive. Among the advice given by the WHO are the use of masks and tissues to cover the nose and mouth when coughing or sneezing. Avoid crowding. Wash the hands frequently for at least 20 seconds with soap and water. Avoid touching the eyes, nose or mouth with dry hands, and most importantly, go to the doctor as soon as any of the symptoms are identified. I invite you to check some digital information. Let's see Telesur. Venezuela reaches agreement with PAHO to fight COVID-19. The Vice President of Venezuela, Delcy Rodriguez, reported this Thursday the signing of an agreement with the Pan American Health Organization to access resources and expand the requirements to combat the COVID-19 in the South American country. We have had the possibility of having $10 million that are resources of the Venezuelan people to attend to our doctors, health personnel, and the patients of COVID-19, said Delcy Rodriguez. In this context, the Vice President said the country will be able to access this money in order to fight and protect our doctors, health personnel, and the patients of COVID-19. For its part, PAHO said the funds will be used to finance the implementation of measures to reduce transmission and strengthen care in the states most affected by the coronavirus. In the last 24 hours, Venezuela registered 651 positive cases of COVID-19 by community transmission and 50 of imported origin. In addition, 4 new deaths were recorded. The Vice President stressed that at least 60% of patients with this virus have recovered their health and that 7,035 active cases remain. Another digital site, the Russian news agency Sputnik. Nicaragua interested in Russian COVID-19 vaccine. We are having a dialogue with Russia. In fact, we were recently in a virtual conference in which our competent authorities expressed our interest in accessing this type of medicine to counteract the pandemic. Carlos Fonseca Terán, Secretary of International Relations for the Sandinista National Liberation Front, told to Sputnik. We have historical relations with Russia, and of course cooperation is an essential part of our foreign policy. There are great ties of brotherhood with Russia. Many Nicaraguans studied in Moscow. Our army was formed in Russia. We have great historical and cultural ties, affinities that come from many years of common history. Without their help, our revolution could not have survived its first stage in the 80s. Russia does not feed on abuse, as imperialism does. In recent months, cooperation between the two countries has increased within the framework of the fight against the COVID-19. On June 10, Russia donated 5,000 tests to Nicaragua to detect patients with COVID-19 as part of its support for the contingency plan. I'd like to suggest you the reading of an article published on the Inter-American Development Bank website and published on July 27th, and it's titled "The COVID-19 Vaccine: When, How, and at What Price?", written by Maria Soledad Plans. I'll read some of its paragraphs. Concerns about the functioning of the healthcare system have been compounded by expectations for a formula that can stop this virus from circulating so easily. But to believe that finding a vaccine or vaccines will be a panacea and immediately end the pandemic is a mistake. Between 12 and 18 months is the possible horizon that specialists calculate for us to have a first version of the vaccine. In general, vaccines take years, even decades, to develop. In the case of COVID-19, experts agree that the speed at which the various actors involved are working is unprecedented. Developers are combining new technologies which allow faster advance with traditional technologies that, while giving more widely spaced results, allow the scalable vaccine production. The problem with this new platform in scale production, it is very likely that the older technologies will end up catching up with the new ones, as the new ones will get stuck in the production process, creating a bottleneck. Even if the processes are accelerated and a financial risk is taken, it is unacceptable to take a health risk. It is true, the world needs a vaccine against COVID-19 as soon as possible, but the evidence that determines that it is effective and safe for use in humans cannot be rushed, summarized, or replaced by shorter producers. The experts consulted agreed that the best form of distribution and the only way to fight the pandemic is a global distribution and allocation system. Furthermore, it is the one and only way to ensure that the necessary funding is raised, investment is made at high risk, and the vaccine is made available at an appropriate price. On the one hand, the cost of developing and approving a drug must be considered. On the other hand, the cost of producing a drug on a large scale. $2 billion are needed for research and development of 3 vaccines that can be licensed and then scaled up as a matter of equity and also to cope with the risk. It is desirable to reach an agreement between governments, philanthropic organizations, international agencies, and private companies to do their part in accelerating the process. As popular wisdom says, alone we go faster, but together we go further. It is important to manage expectations and know that the mere development of a vaccine does not end the pandemic. At the same time, it is clear how important it is for governments and agencies to work together to fight the virus. In this regard, investment in vaccine research and development must continue beyond the COVID-19 pandemic. In addition, existing vaccination campaigns need to be continued. Vaccination rates have fallen in many countries, and this is a cause for concern. COVID-19 is the challenge that currently takes away our sleep, but it is not the only one challenge we face. Let's map out the current impact of the pandemic. Let's review the numbers. COVID-19, main outbreaks of the pandemic. The SARS-CoV-2 coronavirus, which causes the COVID-19 disease, has now reached more than 17,339,700 positive cases and more than 673,000 fatalities. It was initially identified in 2019 in China, especially in the city of Wuhan, but then it spread to the rest of the world, where new outbreaks were recorded, as in Europe and America. In May, the World Health Organization declared the latter nation a new epicenter. Although the most infected countries are the United States with more than 4,600,000 cases and 154,590 deaths, and Brazil with more than 2,500,000 positive cases and 90,300 deaths. Colombia has been identified in recent hours as a new focus of the pandemic in Latin America, with a rate of 10,000 cases per day, while recording 27,655 positive cases and 9,454 fatalities. Another country of concern is Mexico, which already has more than 408,440 positive cases and more than 45,000 fatalities. In Europe, the outbreaks already make the existence of a second wave, a contagion, a reality. Russia, one of the countries leading the race for the vaccine, has already accumulated 834,499 positive cases and more than 13,000 deaths, followed by Spain with 332,510 cases and more than 28,440 deaths. The United Kingdom with more than 302,000 cases and almost 46,000 fatalities, and Italy with 247,158 confirmed cases and more than 35,000 fatalities. In Asia, India raises concerns, already has over 1,639,000 positive cases and almost 36,000 fatalities. South Africa has become one of the world's great COVID-19 hotspots, with more than 471,120 positive cases and 7,497 deaths, and it is the fifth most active country in the world, around 114,000. In the Middle East, one of the most affected countries has been Iran, since the sanctions imposed by the United States have prevented the purchase of medicine and medical supplies, a fact that is reflected in the figures. 301,530 positive cases and more than 16,500 fatalities. This is how we see the world today in the midst of this pandemic. Now let's take our first break in our critical move. Remember, there is a strategic move in social media. As the race to find an effective vaccine against COVID-19 continues, the world is torn between universal non-profit distribution and the sale of patents to the highest bidder. Which position will prevail? Leave your opinion. Let's take a short break and we'll be back soon. After alarms were raised over the spread of the pandemic, several nations have already conducted medical trials to find an antidote to the deadly disease. Let's review the context. In the global fight to curb the pandemic, not a few pharmaceutical companies and governments are working on a drug capable of fighting the novel coronavirus. Some have declared that the vaccines will be for the public good and non-profit, while others are beginning to show tentative prices. In the midst of a race in which even nations with the resources are buying large quantities of doses in advance. Such is the case of the American Modern Biotechnology Company, which calculates the price between $50 and $60, according to the Financial Times. Other companies such as Pfizer and American Company have said that they plan to make a profit from their vaccines, while some drug manufacturers, including Johnson & Johnson, have announced that their vaccines will be non-profit. With government funding of £84 million sterling, Oxford University is working with AstraZeneca Biopharmaceutical on the large-scale manufacture and possible distribution of a vaccine. Its plans for clinical development and production are moving ahead at a fast pace. Likewise, Russia is racing against the clock to start production of a COVID-19 vaccine. The scientific authorities announced that from September, the massive production of its two main vaccine candidates developed by the research centers Nikolai Gamaleya and Vector will begin. According to the President Vladimir Putin, the his country is studying the possibility of carrying out the third phase of trials in Saudi Arabia. In parallel, in China, a vaccine against the novel coronavirus developed by the biopharmaceutical Casino Biologic and the military research unit has shown results capable of inducing immune responses in most patients, as revealed by a phase 2 human study. The government of the Asian giant has reiterated that its vaccine will be of universal public good. Recently, Foreign Minister Wang Yi, in a meeting with his Latin American and Caribbean counterparts, announced that his country will offer a 1 billion credit to the nations of the region so that they can access the vaccine. Scientists from Brazil, Argentina, Colombia, Uruguay, Mexico, Chile, and Cuba have also announced advances that will improve the treatment of the disease. In the case of the Antillean island, the distribution and use of recombinant interferon alpha-2b has been a great contribution to the fight against the coronavirus. In parallel, the Russian Direct Investment Fund expressed the possibility of producing the antiviral drug Avifavir in the Caribbean nation. We start the analysis in our critical move. We have both from Chile, Esteban Maturana, doctor, union leader and vice president of the National Confederation of Municipal Health Officials, and Jonas Schreiderman Figueroa, associate professor at the Institute of Biomedical Science of the University of Chile, biologist, doctor in science with specialty in microbiology. Welcome both of you to our critical move. Jonas, if you allow me, I will start with Esteban. I'd like to ask you, having done this review, where are we now for the discovery and distribution of the COVID-19 vaccine? How close are we? Truth is, according to the information of the countries that right now are running this race to get the first place in the manufacturing of the vaccine by the end of this year, starting the next one. There are some available in the world. The expense in which a vaccine can be validated is now less than a year. And in this case, it lasts a lot more than that because of the need to guarantee that the vaccine is reliable. And in the fabrication of the vaccine in a record time, within a year approximately, obviously, we would want to start massive vaccination for 2021. But there is a security problem of the vaccine. But unfortunately, in the brief space time we have, there is obviously a race, and there's obviously some who don't have a way to guarantee that the vaccine will be completely secure for the patients. Thank you, Esteban. Stay with us for a couple more minutes. Based on this that Esteban was explaining, let's go deeper so that the audience of Telesur can understand the tedious path that the scientific community is going through in finding a vaccine, not only COVID-19 but in a general way. What are the protocols? Well, one thing is the protocols that have been followed historically in this process that we are living right now. And the processes have been accelerated in the whole planet. There are some preclinical trials that can provide stages like in animals and other models. Then we have what is known as the security trial stage, that is called security, and then comes another one. And then there is a third stage of the trials, which are the effectiveness trials. And obviously this whole process used to take between 5, 10, and in some cases 15 years. And particular for the COVID-19, there has been an impulse from the states. So the preclinical stages are not even carried out. There are some candidates for the vaccines, some proposals that have been tested directly during the first stage in humans. Thousands of people where it is proved that within this group of maybe 30, 40 group of people, the vaccine wasn't have toxic effects. But tested in that small number of people, let's say that. In the stage 2, it's tested in people who respond. In this case, the vaccine generates a response. But the test of effectiveness, which is the third one, the last one, it should be tested in around dozens and hundreds and thousands of people, and after a period, the results are compared. The people who received the vaccines with other people who didn't receive, and see how they react to respond before the disease. And in the case of the candidates for the COVID-19 disease, there are some candidates from diverse origins. Some of them are already on the stage 3, promising already some results. But I will call the attention to the fact that currently all the treatments, all the drugs can have weird and unusual effects, and those weird, those secondary events can only be detected precisely when these tests are carried out in many people. And in those trials on the third stage, when those weird things start to emerge and start to happen, because there's a huge number of people who has been tested, and now we are still waiting to see what will happen with these vaccine trials. Thank you. I also invite you to stay with us for a couple more minutes. Esteban, following the same line, what risks does the world face which are not followed? Well, when the necessity of a vaccine is brought forward, this had to do with the main objective, which is to protect the population from a virus, in this case, the SARS-CoV-2. And for this, there's a need to produce a vaccine and to create immunity, to create so that the moment that a person reaches contact with the virus, and there's a second side, is this side which is very harmful for the life and security of the people. We can see the case in other vaccines, some allergic issues. There are vaccines that can produce a very intense and violent reaction. Some sort of disease that we want to protect the patient from. But this thing has happened in the world before. And we need to try to avoid that at all risks. And other issues that we have to do with the vaccination program around the world. And we have seen in a very manipulated way, and we have seen a network of issues in many countries that have kept us from moving on in the vaccination progress. But this vaccination has been one of the biggest discoveries. And thousands of millions of people who have died because of it, and because of many other diseases. We have been able to avoid that thanks to the vaccines. But there are very harmful issues that we can find when it comes to vaccines that have been seen all over the world in other times. And we have seen problems and issues that the United States have been facing also with this. But the most important thing about the vaccine is that one has the effect to generate the protection that is needed. And by the time that it enters in contact with the virus, and secondly is to avoid all the harmful effects that a vaccine can show. Use all the protocols that have been established by health organizations and the World Health Organization and PAHO in Latin America. This COVID has generated a very quickly situation, and the World Health Organization have called on to all these and all the processes that have been accelerated. Obviously, there are some economical interests. We are talking about thousands and millions of dollars because the first laboratory that accomplished to get a vaccine will obtain a lot of profits, etc. But the most important is to accomplish to have the vaccine and generate protection for the humankind. And obviously, it will emerge a leadership in this matter, which is extremely good and beneficial for the country. We would hope that there could be enough prudence and moderation from world governments and organizations to use wisely this process. Thank you, Esteban. Jonas, one of the doubts that is frequently presented to the citizens, it is the characteristic that a vaccine to prevent the novel coronavirus could have. And I talk about novel coronavirus because it has been timely disclosed that coronaviruses are not so new in the world anymore. It is just that this is one of the types of coronaviruses that the world has had to deal with lately. In general, not to go into detail, what characteristics should this vaccine that is being sold go through? The results, especially the main objective and the results is that once the person is vaccinated, they doesn't get the disease anymore, because if they get the disease... Hello? Yes, we can hear you. And if the person is affected, we hope that it's not from a serious disease, because if the infection occurs, we hope that it could be in a moderate way. Now, from the point of view of how the specific characteristic of the vaccines should be, well, we hope that it could be possible that this protection can be achieved with not a high dose of the vaccine. So it's possible that if it could come in higher doses, probably at the end most people would end up leaving the vaccination progress. There are many vaccinations who are in a very more improved stage. Every person will have available a vaccine. So that is something, but that is something that is still being developing. So as I said before, we desire for a vaccine that doesn't have collateral effects and allergic reactions. But this, I think, this will have a lot to do in a way that I also talk about the less and few candidates that have been tested, let's say in the United States, also in England, and also in China, who are the ones who are more improved. How is this going to work on any of them? This is what we still have to wait and see what's going on. Well, thank you so much for this explanation, and I also thank Esteban for your time for our critical move of Telesur. So let's take another break in our critical move, but let's remember that there's a strategic move in social media for you to participate with us. As the race to find an effective vaccine against COVID-19 continues, the world is torn between universal non-profit distribution and the sale of patents to the highest bidder. Which position will prevail? Leave us your opinion. Stay with us. We'll be back soon to continue with the analysis. In the midst of this race to find a vaccine capable of slowing the process of COVID-19, I invite you to review how the private and public health systems have been set against each other during the current pandemic. The health crisis caused by the novel coronavirus pandemic has exposed the collapse of the global health system, especially in countries where privatization of health services is predominant. In the midst of this situation, public hospitals are suffering from a lack of personnel, one of the consequences of the cutback policies of neoliberal governments that privatize private clinics. In countries like Italy and Spain, the lack of personnel became more evident. Health inputs and primary care gradually deteriorated in the face of increasing numbers of cases. In the United States, where public health care is practically non-existent, medical costs are exorbitant for patients. For example, tests for COVID-19 cost over $3,000. In addition, at least 27 billion people are not covered by health insurance. While doctors, nurses, health and maintenance assistants are applauded for their heroic work in the face of the pandemic, requests to open more jobs, equipment, and solutions to provide a more adequate health service have been denied. Experts say that the possibility of a considerable number of people dying because they do not have access to crowded hospitals has turned the health crisis into a political crisis in nations with neoliberal governments that seek to avoid it with forced isolation measures for fear of losing profits. Okay, we continue with the analysis. We have Gonzalo Basile, Director of International Health of CLACSO, Director of International Health Program CLACSO in Dominican Republic. As always, it's a pleasure to dialogue with you about health issues, specifically the impact that the COVID-19 has had. And especially today we are I'm sorry that I have my tongue a little bit twisted. It seems like it's going to last. Well, we are limiting ourselves to the issue of finding, producing, and generalizing a vaccine, which the world awaits with urgency, in treating a tumultuous path. As our previous guests have said before, we must give time to time, because that is what the public demands. Let's say in the first place, it's very important to make a context. Let's say the discussion of a vaccine of a global dimension. In the first place, I'd like to take, let's say 1 minute, that thing that we call the financial industrial medical complex, which is a branch that moves on economical sides and interests over public health. And also, we can see where there are the pharmaceutical industries, good private services industries, assurance and building hospital industries. There is a global market, very complex. And for a long time, it would take a long time to describe and analyze. We don't have anymore the pharmaceutical industry for more than 50, 60 years ago. When we see the drug as just a pharmaceutical drug production, we see a lot of things, a complex, let's say, in a global market. And let's say that in that, approximately thousands, would say like 5 or 6 times more that it was presented back in 2010. So in this global market, it's a market that has geopolitical concentration. So the consuming industry, which produces drugs and medication, it's a very highly concentrated complex. in the so-called countries global that generate the major of incomes of we're talking about scientific researching and say other places, for instance, the United States, which has, I don't know, maybe 40% in the market, and others that represent maybe the 70% of consuming drug and pharmaceutical products, and others who represent, let's say, 5%. Well, we need to analyze also how that geopolitical market is working.
Es un mercado que decía Gonzalo tiene
Gonzalo was saying that it is a market that has profits. So let me know if we still have it, at least through the telephone line. Listening to you, a doubt is arising. How is it possible that having the United States that percentage in the market of pharmaceutical production, it is precisely the epicenter of the pandemic, or is it that one thing has nothing to do with the other? No, not necessarily there is a relation, because the reality, we need to understand that the vaccine market is a market that has suffered an accelerated process of privatization. The World Health Organization had it, and the international community have had their role in the public health, and a lot of authors and researchers have proved that 90% of the medication progress is being financed, and the 80% of the budget comes from the private sectors and not from the states. So if the world of vaccines were free, we see that the highest percent are financed by these pharmaceutical companies. So when a donor gives money, inside in the pharmaceutical industry, well, in reality, in the first place, that representation it's also presented in the experts committees. That happened back in the H1N1, and we could say that the business is individually selling vaccine to an individual person. It's not like that. So in the middle of such a pandemic, it would mean like to produce, we see millions of people around the world, so the business of the vaccine would be to achieve that the countries make mandatory the use of these vaccines, and the ones who will end up buying the vaccine. What I'm trying to say, so in this game of geopolitical power, we see that Caribbean and Latin American countries, obviously, they are players inside that accelerated market, where if we could surpass over the four biggest projects, we could say China, the Sinovac, or we could talk about China, which are the two where China is involved, and in the rest of the other clinical trials, the ones from Oxford and others, we're talking about a multinational pharmaceutical company, which is very modern. Also, the National Institute of Allergies. So we see that everyone is involved in this dynamic around the vaccine, and others who are also in the phase 3. So what really concerns us and keeps us awake is that in all these private investments, we could say that they're closing doors, and many countries are investing in the trials in this organization to come to an agreement with doses and quantities. We could say that this is an emergency and a capitalism, and countries from the south obviously negotiating, and they are in worse conditions to enter into a debate around the vaccine. and it comes from a health sovereignty of our societies. But we can also see a certain eruption of emerging powers, and that are precisely the needs of the countries that, due to economic conditions, remain in the middle of this competition. How do you see the role of China, Russia? So, as you say, they establish alliances with nations, even in Latin America, not only to help them in the provision of medicines, but also to produce medicines on a large scale involving vaccines. Yes, without a doubt, there could be a geopolitical perspective, as well as you said, at least in all the trials that I have known, the one from China that has been in the private sector, while in the Biological Products Institute of the National Pharmaceutical Products in China, the one that carry out 96,000 tests, and on the third phase they're going to do it in Emirates Arabs. So there is initiative of, we can see how China as a player in this market, in a worldwide pharmaceutical production, they represent 51% of the market. And then there are other medium companies that represent 23. And China inside this market, obviously, is like a third player that, from countries from the south, it could be a player that would present some sort of grades of autonomy to provide the vaccine as a global public good. Let's say that, we could say that an expectation, but that expectation on China, it cannot be outside other countries. Without a doubt, there is a challenge of health sovereignty with the vaccine in the case of the SARS-CoV-2. So the regional with coordination of our countries to be able to work in the access to the vaccine in a common and regional way. Let's say if Brazil negotiates on one side, Argentina on the other side, Venezuela in other side, and Dominican and Central American in other side, it will be impossible. This would be so much difficult to be able to get what always urges us, which is the guarantee of a vaccine. So the vaccine doesn't guarantee the universal access to fight the coronavirus. And also because all the variables in these vaccines are variables that immunize what we need to fight the disease. But without a doubt, populations that have more need of these vaccines. So I think I was putting the eggs over the world health public good. And I was making some sort of call on to go back to the regional situation on this kind of international collective health. Well, excellent. Thank you so much. See you soon. Well, thank you. See you soon. Let's go to conclusions. The world is in a real race against time to get an effective vaccine against the pandemic. And along the way, we can see everything, from good intentions to produce for everybody without profit, to the dream of the big pharmaceutical companies to patent first, to sell first. In this context, that silent but deadly virus continues to gain ground. And what is worse, months are approaching when, either because different governments have declared flexibility prematurely, or because the climate conditions favor the coronavirus, the number of positive cases could grow. Hence, the need to have as little social contact as possible. This is the vaccine that, for now, we all have on hand. The rest is still unwritten. For today, we close the geopolitical board.